Hello viewers. So today's video is going to be a bit of a diversion from the usual content that I upload in my channel. So the reason I decided to do this video is because of the number of questions I was getting from my friends and relatives regarding the various alternate medicine treatment options and prevention options for the coronavirus pandemic that we find ourselves in. See, I've had relatives from abroad who have bought these medicines in India and are taking it there to protect themselves and their families from this pandemic. So, this wonderful magical treatments cropping up only in India and nowhere else in the world has prompted me to do this video. So, when I see the current situation, it reminds me, it draws some comparisons between a small scale scam that I had the opportunity to witness firsthand some 15-16 years ago. So this was during my MBBS time when I was a first year MBBS student in one of the medical colleges in India. There was this guy who used to stay in our hostel. Let's call him Mr. B. Now, Mr. B was quite the character to look at. He was of above average height, he was very heavy set, and he carried himself very well, always dressed immaculately. He could speak eloquently. He could pick up a conversation with someone whom he had just met and easily establish a rapport with them and make them feel comfortable. And also, he was a good deal, at least 10 years older than the rest of the inmates in the hostel. Now, on the other hand, there are first years. Now, these students would have come from all over the country. So, everything is new for them, new state, new people, new language. Moreover, the subjects they have to study are vastly different from what they did in their 10th or 12th. The way to approach question, everything is totally different. So you can imagine the stress they will be in. Moreover, there is this added complication, the first year university exams. If you fail in any one subject in the university exams, you cannot move on to the second year. And you will find yourself in something known as the odd batch. So if you catch any first year during the time of first year universities, their mental state will be something similar to what we find ourselves now today with regards to this corona situation. We'll be anxious, scared, not sure of the future. So it is in such a situation that Mr. B approaches them. Mr. B approaches them, and naturally the topic of exams will crop up. So he'll say, "You are worried about your exams. Don't worry. I know someone in the university who can get you passed." Now you should understand who is saying this. I told you Mr. B is at least 10 years older than the rest of the inmates. That's because Mr. B has not cleared his exams for 10 years. He was supposed to have finished his MBBS 10 years ago. But in that state of mind in which the first year find himself in, he does not think about all this. He does not find the obvious flaw in Mr. B's offer. He clutches at the ray of hope that Mr. B is offering him, and he'll ask, "Oh, sir, you are able to do that. Will you do that for me?" Mr. B will be like, "Yes, I'll do that for you. I'll just talk to my friend in the university and get back to you in 2 days." And after 2 days, Mr. B will again approach the first year student and he'll say, "Yes, I've spoken to my friend who's a top level official in the university. He has agreed to pass you. And moreover, he will, as he is my friend, he will do it free of cost. And I too will do this free of cost for you because you are my junior, you're like my brother, I'll do it free of cost." But the only small issue is there are these peons and clerks in the university who actually handle the marks card and who actually do the mark entering and all that. We need to grease their palms a bit so that everything goes smoothly. So you do one thing, you give me 10,000 rupees for those clerks and peons in the university, and I'll make sure you pass. Now some of the first years will fall for this scam and give Mr. B 10,000 rupees. Now what will Mr. B do about this 10,000 rupees? He will do the same thing this alternate medicine treatment and prevention and all that does for corona. Absolutely nothing. Now exams will come, practicals will come, and finally the results will come. Now if 10 students had paid Mr. B this 10,000 amount, at least 5 of them would have passed on their own, and they will become unknowingly, they will become promoters of Mr. B. They will be telling their friends and juniors how Mr. B helped them pass. Now, what about the other 5 who have failed? Mr. B would have a perfectly good explanation for them also. He'll say, your batch was exceptionally bad, almost 20 people failed, so he could only manage to pass 15 people. The last 5, the 5 who scored the least marks, I could not pass them. But I am sorry for you. I am sorry about your condition. The money you gave me, I've already used, and I've already given it to the university people. I will not get it back, but I will still, from my pocket, I will refund you because I feel sorry for you. Or better still, you have to give this exam after 6 months, right? I'll make sure that you pass on priority. I will put money from my pocket and make sure that you pass. You don't have to pay anything again. Some of the students would fall for Mr. B again, or some will say enough is enough, just give us our money back. Then Mr. B will return that 10,000 which he took from them. Now, one of the most remarkable things about this scam I felt was that Mr. B was not someone who met these students at some shady location or just met them before the university exams. He was someone who lived with them 24/7. They could have easily found out if they had asked some of the seniors or some of the faculty members. They could have easily seen Mr. B for who he really was. But they somehow, because of the mental state they were in, they somehow subconsciously preferred to believe the false hope Mr. B was selling them. With regards to these alternate medicine treatment and preventive options out there, the literature is out there. What claims they are making these medicines will do and how these medicines work. It's all out there. We can easily read and make a judgment for ourselves. We needn't be doctors or men of science to understand them. For example, one of the claims they make is that the drug increases the immunity. What do you mean by that? If your immunity were to increase, you will get allergies or anaphylaxis and you will die. You don't want increased immunity. You want normal immunity. Now, increasing immunity is similar to the old wives' tale which says that carrots increase vision. Now, if that were true, rabbits would have X-ray vision by now, right? Because they eat carrots all the time. So the fragment of truth in that old wives' tale is that vitamin A is required for good vision. And if someone is deficient in vitamin A, he may have decreased vision because of that. If such a person takes a lot of carrots, which is rich in vitamin A, his deficiency may be resolved and his vision may become normal. But that doesn't mean that someone who has visual loss for some other reason, for example, someone with cataract, is there any point of feeding him carrots? Similarly with immunity, if somebody's immunity is deficient, is impaired, it is true that he has a higher risk of getting coronavirus infection, and the disease may have a more serious consequence on such a person. So you have to find out why his immunity is impaired, what disease or deficiency is causing his immunity to be impaired, and address that. Unfortunately, there is no magic treatment or magic carrots that can universally restore everyone's immunity to normal. So you needn't be a man of science to figure that out. It's just basic common sense. Now the authorities, at least the more sensible authorities, do not actively promote the use of these alternate treatments. When asked directly during interviews and such, usually the concerned authorities, they make some passing comment yeah, if the citizens are able to improve their immunity by some means, isn't it conducive to our cause? Usually they make some comment to that effect. The reason why they take this stand, I believe, is because offering some treatment, even if it is not proven to work, it helps to improve the morale of the people. It gives them some hope. But is that the right thing to do? To explain that, I will go back to the example of Mr. B. Now, of these 10 students who paid him, their personalities and characters will be in a spectrum. So, two of them will be there in the extreme end of that spectrum, who are very anxious people, very anxious, worried more than the rest. So they are so anxious and worried that they are not able to concentrate on their studies. So when this Mr. B provides them with this solution, even though it is a false solution, it gives them some solace. It takes away some of the worry. They'll feel that, yeah, Mr. B will help me to pass, so I'm sure of passing, so I can finally sit down and study. So it may help them to concentrate, and they may be able to sit down and study, and they may pass ultimately. So here Mr. B has actually helped them to pass. But does that make right Mr. B's scam? No. I tell you why. Because for these two on this end of the spectrum, there are other two on the other extreme of the spectrum who feel, yeah, we have paid Mr. B. Now let our money do the work. Mr. B will help us pass. Why should we study? We can cut down on our studies or not study at all. Let money do the work. Those two will definitely fail, and Mr. B has directly harmed them. The majority, the other six, will be like you and me. They will be thinking, yeah, I've taken this additional step, I've paid Mr. B, but this is my first dealing with him. He may or may not deliver, so let me do my part. I will study well and see what happens. Same thing happens with the pandemic situation and alternate treatment. If you are one of the people in the extreme spectrum, you are very worried, not able to function because of your worried about your health, worried about your family, not able to sleep because of that. And if this treatment option is giving you some solace, helping you to sleep at night, yeah, then by all means take it. If you are in the other end of the spectrum, who feel that, yeah, after taking this treatment, your immunity is so improved that you have now become immune to the coronavirus, and you think, I needn't maintain the social distancing or wear a mask or wash my hands so diligently because me and my family are now immune to the virus, then please don't be foolish. Now if you are like the majority of the people who feel, yeah, I've taken this additional step, let it help me or not help me, I will follow what other instructions are given to me, then it is up to you to make a informed decision. We as functional, educated members of this society have a social obligation to make an informed choice. Don't just take any substance or medicines because everyone else is doing it. You find out what is that substance that you are supposed to take, what claims are made that that substance does for you, and how they know that that substance does that for you. Only then you make an informed choice, because nobody likes to be taken advantage of. Don't let people take you for a ride just because of on the situation you find yourself in. Thank you. Thank you so much for your patient listening. This has been an exceptionally long rant. Thank you once again for your patient listening.